This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about Raynaud's disease. About 5% of the population in the United States have this condition. Raynaud's is a rare disorder that affects the arteries. Arteries are blood vessels that carry blood from your heart to different parts of your body. Raynaud's, sometimes called a disease, syndrome, or phenomena. The disorder is marked by brief episodes of vasospasm, which is narrowing of the blood vessels. Vasospasm of the arteries reduces blood flow to the fingers and toes. In people who have Raynaud's, the disorder usually affects the fingers. In about 40% of people who have Raynaud's, it affects the toes. Rarely, the disorder affects the nose, ears, nipples, and lips. Often, the cause of Raynaud's is not known. This type of Raynaud's is called Raynaud's disease or primary Raynaud's. Sometimes, a disease, condition, or other factors can cause Raynaud's. This type of Raynaud's is called Raynaud's phenomena or secondary Raynaud's. Primary Raynaud's is more common and tends to be less severe than secondary Raynaud's. Scleroderma and lupus are two examples of conditions that can cause Raynaud's. About 9 out of 10 people who have scleroderma have Raynaud's, and about 1 of 3 people with lupus have Raynaud's. Other examples of diseases and conditions that can cause Raynaud's include rheumatoid arthritis, atherosclerosis, blood disorders such as cryoglobulinemia and polycythemia, Sjogren's disease, dermatomyositis, and polymyositis. Also, Buerger's disease, thyroid, and pulmonary hypertension. Repetitive actions that damage the arteries or the nerves that control the arteries in the hands and feet may lead to Raynaud's. Typing, playing the piano, or doing similar movements repeatedly over long periods may lead to secondary Raynaud's. Also, the use of vibrating tools such as jackhammers and drills may raise your risk of developing this condition. Exposure to certain workplace chemicals can cause a scleroderma-like illness that's linked to Raynaud's. An example of this chemical is vinyl chloride, which is used in the plastics industry. Nicotine in cigarettes can also increase your risk of developing Raynaud's. Certain medications can cause secondary Raynaud's, included migraine headache medicines that contain ergotamine, certain cancer medicines like cisplatin and vinblastine, some over-the-counter cold and allergy medicines and diet pills, beta blockers. These are medicines that slow down your rate and lower your blood pressure. Also, birth control pills. If you have primary or secondary Raynaud's, cold temperatures or stress can trigger the Raynaud's attack. During an attack, little or no blood flows to the affected parts. As a result, the skin may turn white and then blue for a short time. As blood flow returns, the affected areas may return to a red color, throb, tingle, burn, or feel numb. Raynaud attacks can last less than a minute or as long as several hours. Attacks can occur daily or weekly. This figure shows arteries in the fingers or digital arteries with normal blood flow. The inset image shows a cross-section of a digital artery. On the second image, B, fingertips that have turned white due to blood flow. And figure C shows narrow digital arteries causing blood flow and blue fingertips. Most people who have Raynaud's have no long-term tissue damage or disability. However, people who have severe Raynaud's can develop skin sores or gangrene from prolonged or repeated Raynaud's attacks. Gangrene refers to the death or decay of tissue. A test that can be done is called the cold stimulation test. A cold stimulation test can be used to trigger Raynaud's symptoms. For this test, a small device that measures temperature is tapped in your fingers. Your hands are then exposed to cold. They're usually briefly put on ice water. Your hands are then removed from the cold and the device measures how quickly your fingers return to normal temperature. If you have Raynaud, it may take more than 20 minutes for them to return to normal temperature. A naval capillaroscopy. You may have a test called a capillaroscopy. For this test, your doctor puts a drop of oil in the base of your fingernail. He or she then looks at your fingernail under a microscope. If your doctor sees abnormal arteries, it may mean you have a disease linked to Raynaud's, like scleroderma. Your doctor may use other tests to look for conditions that are linked to secondary Raynaud's. Examples include ANA antibody, erythrocyte sedimentation rate or ESR, also called SED rate, and C-reactive CRP levels. Treatments include lifestyle changes, medications, and rarely surgery. Examples of medications used to treat Raynaud's include calcium channel blockers, alpha blockers, prescription skin creams, and ACE inhibitors. For a more definitive diagnosis and to test for possible underlying causes of Raynaud's, you must follow up with your primary care provider. Persistent symptoms of Raynaud's, skin changes or tissue injury, or any systemic or worsening symptoms should prompt an emergency department visit. For more videos like this one, please go to edxitvideo.com. And remember, these are educational videos and should never replace the attention or care from a medical provider. Please take a minute to like my videos and to subscribe to my channel. Thank you.